medical student learn this stomatology because this stomatology was interconnected with the medicine. First, the oral factor can contribute to the systemic disease, and second, the systemic disease can have some oral manifestation, and three, the oral complications can happen to the medication and treatment of systemic diseases. And the oral health was considered as a window to your overall health. And this oral factors, oral cavity were interconnected with the whole body, such as the gum disease and the head and neck cancer, and the tooth loss and gum disease can the tooth loss and gum disease can increase the risk of Alzheimer's disease, and the gum disease increase the pancreatic and kidney cancer risk. And some people with the gum disease are at risk of diabetes. And some researchers was found that gum disease were related have an association between the gum disease and rheumatoid arthritis. And so on. First, recently, the Alzheimer's disease was proved have the strong association with the periodontitis. And the periodontitis not only affect the tooth and affect the Can you hear me now? The periodontitis can increase the rates of preterm delivery and low birth rates. And as we see in the photos, and this is a very severe gingivitis in the patient. However, in this patient, the oral hygiene is not as bad as the situation of in gingivitis, and not associated with the the oral hygiene, and this is caused by the diabetes. This is the oral manifestation of the diabetes, a very severe periodontal infection, which is not associated with the poor oral hygiene. And as and when in the dental hospital, if we see this patient if we see the patient like this, we will have a strong advisement for him to have the blood sugar test. The Sjogren's syndrome is the systemic autoimmune disease which primarily affects the exocrine glands, such as the lacrimal gland, which secrete the tears of our tears, and the salivary gland, which secrete the saliva, which moist our mouth oral cavity and eye. And in this Sjogren's syndrome, also affects the bodies, and besides the dry eye and dry mouth, it can also cause difficulty in swallowing, and heartburn, and reflux, and esophagitis. And it also can cause a recurrent bronchitis, and it also can cause the arthritis, muscle pain, and cause the stomach upset, and some autoimmune pancreatitis, and some vaginal dryness, and so on. And this dry mouth may be one of the oral manifestation of this Sjogren's syndrome, which can be detected firstly in the dental clinic. The oral manifestation of Sjogren's syndrome. This is the parotid gland, and the submandibular gland, and the sublingual gland, the three pairs of the major salivary gland in our oral cavity, which secrete the saliva. When the patient suffers from the Sjogren's syndrome, these three pairs of exocrine salivary gland will be damaged, and the saliva secretion will decrease and cause dry mouth. And also, as we've seen in these photos, some of the congenital syndromes, such as Down syndrome and other syndrome, can cause mouth problems, and deformed teeth, and severe periodontitis, and severe malocclusion might be found in this kind of patient. Tuberculosis is an infectious disease caused by the bacterium Mycobacterium tuberculosis. Primarily, it affects the lungs. However, when the tuberculosis is the systemic disease which affects the organs besides the lung, it can cause infection in the oral cavities. And this is the tuberculosis of the tongue, and this is from the ulcerative or tumor-like lesion in the oral cavity. And this is the tuberculosis of the upper jaw. And the characteristic of this tuberculosis of the oral and maxillofacial region is they mimics the oral malignancy very much. Sometimes we will misdiagnose with oral malignancy with this tuberculosis. So the biopsy must be performed before we diagnose the oral malignancy or the tuberculosis. As we know, the HIV/AIDS is the systemic infection which primarily affect the T cell, affect the human immunity system, and this is caused by the HIV infection. In the oral cavity, the in the AIDS patient, they will firstly manifest as with oral symptoms such as fungal infection, the candidiasis, such as the photo in the right side. There's white mucosa in the oral mucosa, lining in the oral mucosa. It can be scrubbed by cotton, and this is caused the infection by the fungus. And sometimes this patient may have the carboxy sarcoma in the oral cavity, such as in this photo, in the photo on the left side. The purplish bleeding area with nodule on the palate and in the gingiva. And in some patients with the autoimmune anomaly, such as acromegaly, this kind of patient will have the facial change in the oral maxillofacial deformity. This is caused by the pituitary hyperfunction of growth hormone. The patient will present as brow prominent, enlarged of nose, lip, and ears, and the jaw prominent. And in some situation, the leukemia, which is known as the systemic blood cancer, can first manifest as the gingival hyperplasia. And this is the case report from the New England Journal of Medicine, the leukemic gingival infiltration. As we seen in the photo, is the bluish-like gingival lesion in this patient. This is gingival hyperplasia secondary to infiltration of gingival tissue with leukemia cells. In some situation, some medicine can induce gingival enlargement, such as anticonvulsants, such as phenytoin and phenobarbital, and some medicine for treating the hypertension, such as calcium channel blocker, the lifidipine and allodipine, and some immune suppressants, such as cyclosporin. It's also medicine can induce the gingival enlargement, such as the patient in this photo. As we can see, the gingiva was enlarged. And in this kind of patient, if the use of the medicine was ceased, the gingiva cannot return to normal because the inside the gingiva, the cells were hypertrophied. we must perform a gingival surgery to resect the hypertrophic gingiva to the normal. And some systemic usage of medicine can cause pigmentation of teeth, such as tetracycline, which have a high affinity to the bone tissue and the teeth tissue. Uh, it it was abandoned to be used in the developing child or the adolescent. And chemotherapy is a major procedure for the systemic malignancy, and the chemotherapy can cause mucositis of oral cavity. It begins 5 to 10 days after the initiation of chemotherapy and lasts for 1 to 2 weeks. It causes severe oral pain, erythema, and difficulty to open the mouth, difficulty for eating, drinking, and speaking, and difficulty for with mouth care regimens. And also, some medicine such as bisphosphonate was a medicine for osteoclast suppressor, which was widely used in treatment of osteoporosis or bone malignancy. And this kind of medicine have a severe oral complication called bisphosphonate-related osteonecrosis of the jaw. About 1 to 2% of these patients with the bisphosphonate use can cause the jaw necrosis, such as in this photo. And the reason maybe many there are many reasons. The main reason is that these drugs suppress the osteoclast and suppress the suppress the normal environment of the bone tissue. And radiotherapy is a routine treatment for head and neck cancer. It can damage besides it kills the tumor cells, it also damages the salivary gland and cause the xerostomia, which is the dry mouth. It is caused by the damage of salivary gland by irritation. It will manifest as the dry mouth, and the mucosa of the tongue was shrink. And secondary to this dry mouth, the teeth of the mouth will be broken rapidly. It is called rampant caries, because the saliva can protect the teeth from dental caries by suppressing the bacteria and provide some calcium for the calcium and decalcium of the teeth balance. And also, the radiotherapy of the head and neck region can induce necrosis of the jaw, and this is a very severe complication of the head and neck cancer treatment. It is very commonly seen in Guangdong province, because in Guangdong province, the nasopharyngeal carcinoma has the highest incidence around the world, and the primary treatment of this nasopharyngeal carcinoma is the radiation, no surgery, just the radiation. Sometimes radiation with the chemotherapy together, and this kind of treatment might cause a little bit very low incidence of this severe complication happened. Okay, let's conclude. And historically, the stomatology or dentistry is the branch of the medicine, and it concerns about the diagnosis and the treatment of the disease of the mouth, the facial soft tissue, maxillofacial bones, temporal mandibular joints, and salivary glands, and neck disease. And this stomatology and medicine are interconnected. So it is good for you medical student to learn the basic knowledge of this stomatology. And thank you for listening. And this is the end of today's class. If you have any question, please send email to me and feel free to ask me from the recheck. And thank you for your attention again. And have a good day. Goodbye. Sometimes the internet is not good. If you missing any parts, please ask me. I can go back to that part.